Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Leigh Frame, Executive Director of the GW Office of Integrative Medicine and Health, the Integrative Medicine Program Director, and an Associate Professor in the Department of Clinical Research and Leadership and Physician Assistant Studies here at GW.
And I'm Janet Rodriguez, the Office's Administrative Director. Today, we're going to talk to the leaders of the GW research team, aka Dr. Frame and GW medical student researcher Jacob Hands, who looked at cocoa products in the U.S., lead, and other heavy metal contaminants. This unique study was conducted by researchers from the Frame-Corr Lab here at GW, the GW Resiliency Well-being Center, and the Integrative Medicine Programs. Welcome to GW Integrative Medicine, Jacob and Leigh. This is your home.
It is my home, and I'm glad to be here and extra glad to have Jacob here to talk about this study.
I'm happy to be here.
Yeah. So, Jacob, why don't you get us started? Why are we here talking about this? What got you excited about this project?
Yeah, so first of all, it's wonderful to be here with you both. I'd be remiss if I didn't thank both Dr. Frame for the opportunity and, of course, ConsumerLab.com, who are research collaborators with us and so generously provided the data. Essentially, a broad overview of this topic is that for a long time now, there have been sporadic reports of heavy metals in dark chocolate, which is a food and a sweet we all know and love. And so that was kind of concerning. And so one of the curiosities is this level of heavy metal contamination. So metals like lead, cadmium, and arsenic, are they actually in the chocolates that we eat? How has that changed over time? Does that really seem to pose a biological harm? And does that vary by whether a product is organic or has a certain number of certifications? And really, how do those levels compare to FDA, CA Prop 65, and other standards across the globe?
So that's a great introduction. And I think that everyone listening probably agrees with you and I'm going to guess Janet too, that chocolate is delicious and we all really enjoy it and it brings joy. And people are losing their minds when they see these headlines that chocolate has heavy metals in it. I can't tell you the messages I've received. People are just like, oh my God, you're ruining my life by telling me that chocolate has heavy metals in it. And
how dare you?
Right, exactly. But that's not really what we're saying, right, Jacob? How would you put what we found?
Yeah, I think the important thing is to situate this into the context of just because there is some amount of a heavy metal doesn't mean it's meaningful to the individual consuming it. So in other words, you can safely assume that we all consume different levels of lead, cadmium, arsenic, etc. in our diet, just to varying degrees. Ideally, we would consume none. But the reality of the world that we live in, the soils, pollution, environmental damage, and just natural metals present in the earth is that they're there. And oftentimes they're going to make their way into their food supply, especially when we're eating things that were harvested in the ground, for instance, or near industrial plants. So the key to this is maybe there is metal in chocolate, but what does that actually mean for you, the consumer? And so I think one of the most important findings to come out of this is that the real concern was with a lot of the outliers. So taken at the median, a lot of the levels that we found, and we could get more specific about this, were not actually alarming. In other words, they don't seem like they pose a significant threat to the average person when consumed in moderation, for instance, as a single 1 ounce serving. But for some of the outlier products that we tested, the single dose concentration of metal that you would take in was vastly above different national thresholds for lead, cadmium, and in some cases arsenic. And so the reality of that is that there's a certain point at which the consumer, I guess, would be unsure of whether or not all chocolates, or rather all dark chocolate, is made equal. And so that's one of the things that we discuss is really what are the implications of that. But just so everybody's not too afraid, the reality of it is, taken as a 1 ounce serving and taken in moderation, there is no evidence whatsoever that dark chocolate consumption is a problem. And in fact, of course, it's part of a healthy diet.
That's right. And sort of, for me, there's sort of two take-home principles about this, and they're just general principles for health. So I really want everyone to hear them. The one you've already brought up, moderation. It's not popular, but it's really a key to health, right? Not having too much of any one thing. I do think that chocolate is particularly difficult to moderate. And I don't think I'm just saying that because I have the experience. I think many people have that experience. It's so delicious. So the tip I've been giving for that one is maybe don't have it every day, right? If it's hard for you to stick to that 1 ounce serving, then maybe every other day. And then you could have up to 2 ounces and you're still probably okay. And then the other point that I've been making, and this is so good for so many things, diversity of diet. I know I've talked about it in the podcast for the gut microbiome, but it's important for everything. When you have a very diverse diet, meaning you're not eating the same things over and over again, and you're having a lot of different foods from different sources, what you're doing is you're kind of playing the odds game, right? So the odds that you're getting a heavy metal exposure from any one individual item is much lower because you're having lots of different items and they're coming from different places and having different sources. And the same is true of nutrients, right? So you're getting lots of different nutrients. One example I like to give when we talk about too many nutrients is carrots. Carrots are fantastic for you, but if you only ate carrots, you would have a very limited nutrient exposure. You'd get too much vitamin A and not enough of other nutrients. And so these basic tenets of healthy diet and healthy lifestyle can protect you from heavy metal contamination in chocolate, but also in other foods, as well as many other things. So that's another take home, that hopefully people will now be a little less afraid that there are heavy metals in their chocolate.
Well, I'm still trying to wrap my mind around the fact that you all found that organic chocolate has more issues than regular chocolate. Could you get into that? Because that just completely ruins my whole entire, it's okay to eat organic.
Yeah, I'm happy to take this, Dr. Frame, if you'd like. But essentially, one of the curiosities was, as you pointed out, a lot of consumers, they buy organic, especially in the case of something like chocolate, because they feel like the exposures that they're getting are going to be reduced across the board. And so what organic means is a bit complicated depending on the product and what we're talking about. But a lot of times it refers to the soil's exposure to pesticide for a certain number of years. So in the case of the dark chocolate, what we were curious about is if it is an organic cacao bean or is derived from that, does that mean that you are subject to less exposure from the heavy metals of interest? And so what we found was that actually no, in some cases you were more likely to have heavy metal contamination in the case of cadmium when you were consuming organic products. Now, that does not mean that the product that you're eating, the organic product, is necessarily not going to be is going to give you less exposure to pesticides or something like that. We did not test that, but for all we know, that is still valid. But what it does mean is that if you were hoping that organic would shield or protect you necessarily from any heavy metal exposure, that does not seem to be the case. And in effect, a lot of these products were actually higher in the heavy metals on average.
Yeah, I would also add that the Consumer Reports study, which came, I think, 2022, did not find a difference between organic and non-organic. So there's probably a lot of variation in that. And I think that's true of these products in general, right? Like the amount of heavy metals in them and the amount of heavy metals from batch to batch is going to vary greatly. And that reminds me of something. Another feedback I'm getting is everyone wants to know what the names of the products are. And I'm sort of like, see the take homes. You don't need to know the name of the products, but it's also because of this variation, right? So a product that's low this year maybe end up being high next year. There's no really guarantee that they're going to have the same exposure, particularly as, they may be sourcing based on yields, right? So if a cacao bean yield is higher in one country versus another country, they're going to end up with more of that high yield country in this particular batch, but it may not be that way every time. So I feel like I am getting a lot of pressure. I don't know about you, Jacob, but to name names.
No, certainly. Yeah.
Do you think that has any valid?
So what have you responded?
Well, basically, just go back to the take-home, right? Diversity of diet,
what happens in the Frame-Corr Lab stays in the Frame-Corr Lab when it comes to that?
Well, no, it's just... Sorry, Dr. Frame, please.
No, go ahead.
So there's a couple things. So one, there's legality to this to some degree, unfortunately. And the reality of it is that because there's so much variability, one, the finding of high heavy metal in a particular chocolate could be disputed. And in that case, it is reasonable to assume that there's enough variability in batch to batch that it may not be an accurate representation of every single product this company has ever produced. Therefore, we're wary of that kind of exposure if at all possible. So that's a big one. The heterogeneity also is just kind of in the fact that even if we do say that a certain product was high in heavy metal, doesn't mean it actually is. 3, there are already sites that provide this data. So like asyousow.org publishes a list for free if they would like to check it out, the listeners, on various kinds of dark chocolate and their heavy metal content. And then consumerlab.com, who are our partners, do have a subscription-based model where you are able to access individual chocolate level data if you're curious about the heavy metals in popular dark chocolate brands. So the reality
you
is
get a lot of other supplements with that too, which
I was about to
our
say,
listeners are going to be interested in.
Definitely.
Yeah, if you're a supplement person, then you really do need to get pay the money for the subscription. It's worth it.
Definitely. Yeah, consumerlab.com is a font of information. It's so powerful. And so that's sort of what we've been advising, at least I've been advising in this case, is if you're curious, you can check out consumerlab.com, the other website that I mentioned previously. Both of those should give you very expansive and multi-year information.
So where are you guys going to go from here? Is this a one and done or what?
What do you think, Jacob?
That's a good question. There's a couple things to this. One of the strengths of the study is that we published it over a course of, I believe, 8 to 10 years was the cohort size. And so I think we have a fairly accurate understanding of what the market is like and what it has been like. And so theoretically, more than happy to do a product update as that comes around. But for right now, I think this has provided a really good and robust overview of the state of cocoa and dark chocolate. And I think it's very, very much concordant with previous authors who have found a similar thing. We've just added a bit of nuance and in some cases established a new finding. And so I think for now, we just like to explore more, in the space of nutritional quality, food contamination, et cetera. But I don't know how much more we want to probe into the dark chocolate question. This was very satisfying in more ways than one.
Yeah, I would echo that. I think that, particularly given that our take-home messages are sort of general good health principles, now we would like to have people focus more on implementing these good health principles and seeing healthy outcomes, as opposed to maybe just kind of reproducing the similar findings to what other organizations and ourselves have found. The reproduction is really important. And one of the things that I've talked about a little bit with people is like, what are the policy implications of this? And in theory there, regulators could implement something such as voluntary testing or even, a certification that they could get if they tested as having low heavy metals, because there are ways that you can lower the heavy metal content in these products through the processing and agricultural processes, including, for instance, lowering the pH in the soil. So there is a way to change this. And so if some of those things get implemented, then it would be really interesting to go back and test again to see if, okay, now maybe have things changed, if the agricultural and processing practices have actually changed.
So are there any other key takeaways you all want to share with our listeners?
After you, Jacob.
Yeah, I mean, that's a good question. In terms of key takeaways, besides the active moderation and just being a savvy consumer, I think that one of the interesting things this brings up is really taking active control of your own food quality and food exposure. And it sounds really complicated, but in a lot of ways it's not, right? Like companies respond to what you, the consumer, the person who's eating the product, want. And so we see this with a lot of different products. But as you become more aware, I say you, the audience generally, of what's in your food and what you want, companies will accommodate that. And they'll start to understand that you care about this particular thing. Maybe it's lead in your chocolate, which is totally valid. Maybe it's something else. And so as more people become concerned about this matter, I'm confident that there's going to be at least something in the way of action about this. I don't exactly know what it is, but I really echo the previous point that, some kind of voluntary testing or even recognition of this problem in the first place is huge. So I think the big takeaway is just be more aware. And of course, if at all possible and you're really interested, feel free to check the websites that we've just mentioned to find a chocolate brand that you feel more comfortable in.
Great answer.
It is a great answer. I really don't have anything to add to that. I'm going to just defer to to Jacob on that.
Okay, so Jacob, you are a medical student researcher and you were the lead author.
It's what they tell me.
What does the future hold for me? I mean, are you going to get that MD and then go take care of patients? Or are you more interested in the research side?
Yeah, that's a really thoughtful question. I'm not entirely sure. I kind of, hopefully just going to continue with the education. I really love research. I want to always be involved in it. And so while I love patient care, doing projects like this really excites me. And so I don't really know where that goes, but I'm certainly very, very happy every day to explore that. And I'm very grateful to mentors like Dr. Frame and ConsumerLab.com and everybody else that is kind enough to work with me to get that experience.
And Dr. Corr.
And Dr. Corr, of course, no one could forget.
You're hanging out with the dynamic duo.
Absolutely.
That's right.
Okay, one last question for both of you. Leigh, dark chocolate or milk chocolate?
Oh, dark chocolate, hands down.
Jacob, dark chocolate or milk chocolate?
Dark chocolate, man. Milk chocolate is just too much sugar. It's a lie to you. You get addicted to the sugar.
I agree. I don't want anything getting between me and my cocoa powder. The darker the better.
All right, friends, I think this is a good place for us to wrap this up. Thank you for making the time because, guys, when I say they're getting slammed by the media asking for interviews, I am not exaggerating. It's been crazy. So,
but of course, we had to prioritize the GW Integrative Medicine podcast.
Well, thank you, especially since you're the host.
It's not biased at all.
Okay, so that's all the time we have for today. Jacob, thank you for joining us. Leigh, thank you for being a rock star. This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Leigh Frame.
And I'm Janet Rodriguez.
Thanks for listening.
All right. That is a wrap.